Okay, James, so you mentioned, you're turning 65 next month. I'm sure you've been getting a lot of stuff in the mailbox, lots of people calling you. It can seem a little bit overwhelming.
Absolutely.
The nice thing is when you're working with a broker like myself, we kind of do a lot of the work for you. And so when you break Medicare down into its most simple form, there's really only two options. And so we're going to go through those options with you today, make sure you fully understand what we call the two pathways of Medicare, and then we'll find the right plan for you based off your needs.
Okay.
There's a book that the Department of Health and Human Services send out. You'll get one every year. It's the Medicare and You Handbook. It's also put out by the Centers for Medicare and Medicaid Services. And although you're going to get one of these every year, most people never read it. There's a few pages in here I'd like to go over with you. They really give you a good visual aid of the two different options that you've got for your Medicare benefits. So if you open up to page 5 here, this is what we call the two pathways of Medicare. And so pathway number 1, you've got original Medicare Parts A and Part B. And Part A is your hospital coverage. It's going to cover inpatient hospital stays, skilled nursing facility stays, those types of benefits. And the nice thing about Part A, in most cases, there's no premium for Part A of Medicare. Because you paid Medicare taxes while you were working, you get that part for zero premium. Part B is your medical and outpatient services, and there is a premium attached to that. The standard Part B premium this year is $135.50. That's going to be true for any individual who files a tax return from 2017 and their income is less than $85,000 a year.
Okay.
Now, if you're married and filing jointly and your income is over $170,000 a year, you could pay what's called an IRMAA. It's an income-related monthly adjusted amount. And so does your income fall under that $85,000 as an individual or $170,000?
It's under.
Okay, so we're gonna make a few notes in this little book. This is a guide to health insurance for people with Medicare. It's also put out by the Department of Health and Human Services, and I'm gonna make some notes in here for you based off your actual numbers. So by the end of our appointment today, you're gonna know exactly what your numbers would be if you stayed on pathway number 1 or pathway number 2. And you can see here basically the same chart that we're looking at in the Medicare and You Handbook. So we know for your Part B, you're going to pay $135.50 a month. Now, when you're on original Medicare A and B, it's excellent coverage. It kind of gives you the freedom and flexibility to get your health care anywhere you want to go nationwide that Medicare is accepted. However, it doesn't cover everything. There's some gaps, there's some co-insurances, there's some deductibles that as a Medicare beneficiary, if you did not carry a Medicare supplement policy, you'd be responsible for those. And there's really no limit to what those could get up to if you became very ill. So most people that stay on option 1, original Medicare as their primary coverage, are going to purchase what's called a Medicare supplement insurance policy. It's also referred to as Medigap. So those two words are synonymous. They are the two words for the same thing. But your supplement insurance fills in the gaps that Medicare doesn't cover. And so if you scroll back to section 6 here, or section 5 rather, this talks about your Medicare supplement insurance policies. And I always go through this with individuals so they understand some very important details about your Medicare supplement insurance. It's the fact that Medigap policies are standardized. So that's so important that they put that in bold. What that means is that every insurance company that's been marketing to you, mailing you stuff, calling you, offering you Medigap or Medicare supplement insurance, they're offering you the same standardized policies. And this states that every Medigap policy must follow federal and state laws designed to protect you. They must be clearly identified as Medicare supplement insurance, and insurance companies can sell you only a standardized policy identified in most states by letters A through D, F through G, and K through N. So if you flip over to the next page, this chart shows the standardized Medicare supplement policies. And as you can see, there's multiple options to choose from. For our clients, we kind of cut through that with them. We recommend that you carry a Plan G Medicare supplement policy. And in my professional opinion, it's the best value for your insurance buying dollar. I like my clients to have coverage that works easily, is hassle-free. They're not going to have any hidden costs associated with their coverage when the medical bills start being filed. So the Plan G, we found, is the best value for your insurance buying dollar. And as you can see, it's 100% coverage all the way down the line, except for this one little section right here, which is your Part B deductible. Now the Plan G does not cover that deductible, but the federal government sets that deductible, not your Medicare supplement insurance company. And that deductible is only $185. So it's a very low deductible. A lot of folks laugh at that because they're used to having a $2,000, $3,000, $4,000, $5,000 deductible. So a $185 deductible really doesn't seem like a deductible at all to a lot of our clients. But what's going to happen when you've got Medicare A and B as your primary, and then you've got your Medicare Supplement Plan G as your secondary, you're going to be billed the first $185 of Part B covered services like doctor's visits. So whether you go to your primary doctor, a cardiologist, even a chiropractor, they're going to bill you, that doctor's office is going to bill you for the first $185 of charges. That will satisfy your Part B deductible, and then Medicare is going to kick in and your supplement's going to kick in, and really you should receive no other bills throughout the year as long as it's medically necessary services. So I'm going to teach you how we help you choose a Plan G Medicare supplement policy. We use a quote engine here, and Medicare supplement insurance is priced based off a few things: the zip code that you live in Missouri, the age at which you're buying the policy, so it's going to be 65, your gender, the plan letter, and as we discussed, the Plan G is really the best value for a dollar. We don't use a lot of the other plans unless the Plan G is not affordable for you. It's based off your effective date, and we know we're wanting this to start July 1st. And then also some carriers offer a household discount. Now in your case, you're single and live alone, so there's not going to be a household discount involved. But when you look through the rates here, you can see that the carrier that comes up at the lowest rate for you happens to be AARP United Healthcare at $126 a month. You can see how the prices of these Plan Gs go up as you scroll down the chart here. So you got coming in at number 2 in the rates at $134.01, $136.39. You can see how the rates go up as we go down the list here. Now, the only thing that I like about they're doing that other Medicare supplement companies aren't doing right now is they're trying to compete with option 2, Medicare Advantage, which we'll get to here in a second, with giving you some value-added benefits. So they have a benefit that a lot of our clients are enjoying called Silver Sneakers Fitness Membership. Okay. Are you familiar with that?
I've heard of it. I don't know a whole lot about it though.
So it gives you the ability to go to fitness centers such as the ARC here in town, 24-hour fitness, Anytime Fitness, Planet Fitness, to go exercise. So it's a free benefit that they add on to your Medicare supplement plan. They're the only carrier in Missouri that's doing that right now.
Okay.
And a lot of clients are liking it, but that would really be the only reason you would go with because you are going to pay $8 a month, $8.01 a month more than you would with ARP. So is that fitness membership, is that something you feel like you would actually utilize or benefit from, or is that something that's not really of interest to you?
You know, for only, what is it there? $8 more. I think having that option, would be all right.
Okay. So we're going to jot that down in here for your Medicare supplement policy. We're going to check that box. We'll put Anthem, Plan G, and your premium, $134.01 a month. And really, your only out-of-pocket expense when you've got Medicare A and B and that Plan G is that Medicare Part B deductible. So we're going to jot that down in here just so you remember you're going to pay the first $185 of charges. Everything else is covered after that. Now, there is one other section here you can see that you need to consider purchasing when you stay on original Medicare option number 1, and that's Part D of Medicare. That's your prescription drug coverage. Now, Part D is outsourced and administered by private insurance companies that have a contract with the federal Medicare program to provide your drug coverage for that year. There's 26 of them to choose from this year in Missouri. And there are a lot of wrong ways to choose Medicare Part D. There's only one correct way.
Okay.
I'm going to teach you how to do that right now.
Okay.
Some of the wrong ways are talking to your sister-in-law or going with what your neighbor's got, or even choosing the same insurance company that you get your Medicare supplement through because you think, oh, it's going to be easier to have the same insurance company for my Medicare supplement, my Plan D. Those are all incorrect ways. Using Medicare.gov, which is the official U.S. government website for people with Medicare, is the only proper way to choose a Part D plan. So what we're going to do is a personalized search. We're going to pull you up in this Medicare.gov website. This is a secure site. It's designed for Medicare beneficiaries to go on and do exactly what I'm going to teach you how to do. So we're going to plug in your zip code. We're going to plug in your Medicare claim number, your last name, your date of birth, and your Part A effective date. And then we click Find Plans, click your county. Okay, and as you can see right now, you're just enrolled in Original Medicare, which is correct. Haven't enrolled in anything else, so we're going to help you choose the right Part D plan now. We do that by entering your prescriptions, and as you told me earlier, you take simvastatin for cholesterol, so we're going to add that in. Make sure we've got the proper milligrams. You mentioned you take 20 milligrams, so we put that there in the proper dosage. You take one a day, so we enter 30. And then we take omeprazole for acid reflux, and 20 milligrams on that one a day. And that's the only drugs you take, right?
That's correct.
Okay. Now you can see here there's a lot of pharmacies to choose from, so let me ask you, what's your preferred pharmacy that you currently use?
Usually I go to Walgreens.
Walgreens, okay, so we're going to add Walgreens in there. And let me ask you, if there were another pharmacy in town that would save you money, would you want to compare to switch pharmacies, or are you pretty satisfied with Walgreens and you just want to look at Walgreens?
Let's just stick with Walgreens.
Okay, that'll keep it simple. If you happen to want to look into that, we can add another pharmacy here. In this program, we'll compare those two drugs at multiple pharmacies, and it'll really tell us the best Part D plan in terms of saving you money. So right now, when we look at the 26 Part D plans that are available, all right, it tells us that a plan called WellCare Value Script is going to be the best plan for you in 2019.
Okay.
When I say the best plan for you, we're looking at these numbers right here. This is your total out-of-pocket cost, including your premium, your deductible if you have one, and any co-pays you've got on your drugs at the retail pharmacy Walgreens.
Okay.
You've also can see here you've got a mail order option where if you want to cut out the middleman, you want to cut out the pharmacy. Generally, these Part D plans are going to pass those savings along to you. So you can see it'd save you about $25 for the remainder of this year if you would get your drugs through the mail. Okay. So WellCare Value Script, although there's other plans to choose from, you can see how this cost starts going up. The next best plan for you, the Cigna plan, would be $40 more over the course of a year than the WellCare plan. And you can see how that continues to raise as we go down the list. So we routinely save our clients hundreds, sometimes thousands of dollars just by reviewing their Part D coverage. And you really want to make sure you got a broker that does that for you, because if you can't just choose a Part D plan and stay on it year after year. You really need to review it during the annual enrollment period from October 15th to December 7th. Okay. Big savings can be found just by looking at your Part D. So for this year, we're going to check that off the box and put you with WellCare Value Script if you choose option 1. And we're going to write your $15 premium in there. So when we add your premiums together, and I'm just going to add your Part D premium and your Plan G premium, we're going to leave the $135.50 out because that's going to be a constant. Whether you choose option 1 or option 2, you have to pay that $135.50. That doesn't go away if you go with Medicare Advantage. So for comparison purposes, we're just going to look at these premiums of your Part D and your Medicare supplement. So we take 15 plus your 134.01. That puts you right at $149.01 a month in premium. If you take that times 12, you're going to spend in premiums $1,788.12 over 12 months. And then really your other out-of-pocket expenditure we need to add in there would be your Part B deductible, that $185. So if we add that in there, you can just kind of plan on spending $1,973.12 in premiums and in your deductible if you choose option 1.
Okay.
Now, that gives you freedom, flexibility. You don't have to worry about networks. As long as your doctor or your provider accepts original Medicare, you can use your Medigap, your Medicare Supplement Plan G there as well. We know your WellCare Value script is going to work at Walgreens, and as you travel across, if you travel, you've got Walgreens in every city across America, so that's going to work for you as well. Now, of my personal client base, about 2 out of 3 Medicare beneficiaries stay over here, and that's pretty true in terms of national averages. But 1 out of 3 has moved over to Medicare Advantage as another model of care for their Medicare coverage. Now, Medicare Advantage is not better or worse than original Medicare and Medicare Supplement. It's different. And so we want our clients to be the most educated people on Medicare, so you don't get confused when you go out there and sit down with a friend or a neighbor and they start talking about, well, my Medicare supplement doesn't cost me anything, or my Medicare supplement includes dental and vision. Many times what they're referring to is not a Medicare supplement, it's a Medicare Advantage plan. And so we're going to explain that option to you today as well. Now, just like the Part D plans are outsourced to insurance companies to administer, and I said there's 26 of them available, Medicare Advantage plans outsource all of your Medicare coverage to a health insurance company to administer. Now, these health insurance companies have a contract with the federal government to provide all of your Medicare benefits for 1 year at a time. Consumers, what they like about Medicare Advantage, many of the plans have 0 premium. So here in our county, you've got 14 plans to choose from, and many of them are 0 premium plans. So the first thing you'll notice is if you choose Medicare Advantage as an option, you're going to save your Medicare Supplement premium and your WellCare Part D premium. Mm-hmm. So you're going to save about $1,788 a year in insurance premiums. The Part B deductible also goes away when you choose Medicare Advantage as an option. So you're going to have a net savings over 12 months of $1,973. However, there's some very big differences in the coverage and the way the coverage works. The first thing you need to understand is that Medicare Advantage plans are managed care. They're HMOs and PPOs. And that means if you're in an HMO, your doctors, hospital providers have to have a contract with that Medicare Advantage plan for you to have health care there, except in the case of an emergency. If you're in a PPO, you can go out of network, but generally at a higher cost to you. The other thing you need to understand is that you're going to have more skin in the game. You're going to have more co-pays and cost sharing and co-insurances when you use this coverage. Unlike your Medicare, original Medicare and your Medicare Supplement, where you just have that $185 deductible and everything's taken care of for you after that, over here you're going to pay as you go. And so there's some things we need to consider when suggesting Medicare Advantage. First of all, we need to look up all of your doctors. Are they in network? Are the hospitals that you want to go to, are they part of the plan? We need to factor in any health conditions you have, any serious or chronic health conditions. It's not a great idea if you've got ongoing treatment for something as serious as cancer, or upcoming surgeries where you could have some follow-up therapy and out-of-pocket cost. You may want to delay looking at Medicare Advantage as an option. It's an option that we notice a lot of our younger, healthier Medicare beneficiaries are choosing, but there's some risk involved. Many of the Medicare Advantage plans in our county here have what's called a maximum out-of-pocket limit, which means you're taking on financial exposure up to $3,400 a year. So although we can save you in premiums and deductibles $1,973, you're taking on $3,400 in out-of-pocket risk if you become very ill. The other thing, in addition to the savings that Medicare Advantage members like, is this little box right here, these extra benefits that we talked briefly about. Many Medicare Advantage plans are going to give you preventative dental coverage. Some will give you comprehensive dental coverage. They're going to give you routine vision coverage and coverage for eyeglasses or contact lenses. Some of them even have benefits called over-the-counter essentials now, where you can get your vitamins and toiletries and personal care items. They give you money each month or each quarter to buy those things. Some plans $300 a year, $360 a year. So if you add up the savings of your Medicare supplement and then all the additional benefits that you gain, I mean, you utilize those benefits, you could be gaining thousands of dollars of additional benefits over here. But the main thing you're giving up is some of that freedom of choice. Because if your doctor exits the network, if they decide, not to be a part of it the following year, and you're in an HMO, you can't see your doctor anymore. And that's something you just don't have to worry about when you're over here on option one. So again, two different models of care. One's not better or worse, they're different. Some things you need to understand, being a new Medicare beneficiary, because you're turning 65 and taking out Part A and B, you have the option to try out Medicare Advantage plan risk-free for 1 year. So you have what's called a trial right period. If for any reason you don't like your Medicare Advantage plan, within the first 12 months, you can leave that plan and go back to original Medicare, no questions asked, the first day of the next month. We could put you on a Part D plan, and we can choose any Medicare supplement plan you want. No problem there. However, if you choose this Medicare Advantage as your first option and you decide to stay in that plan more than a year, which most people do because they work well, especially while you're healthy and not doing a lot of doctoring, you stay in it longer than a year, then you are locked in until the Medicare annual enrollment period, which is October 15th to December 7th. At that point, for the next year, so at this point it'd be 2020, you could move back to Medicare A and B and take out a Part D, no problem, during that annual enrollment period. But you'd have to health qualify to get back on a Medicare supplement policy. So if you're in a Medicare Advantage plan longer than that first 1 year trial right, and you develop some health conditions, worst case scenario, you may not be able to get back on a Medicare supplement insurance policy. So again, there's some risk involved here. If you choose a Medicare supplement as your first election upon going on Medicare, and at any point later in life you decide you want to try out Medicare Advantage, you open up a new trial right at that time because you've dropped a Medicare supplement policy and joined a Medicare Advantage plan for the first time in your life. So whether that's at age 66 or 76, you're going to get a 1 year risk-free trial right at that time as well. So you've got some options to try out Medicare Advantage later in life. If you get out there and find out that a lot of your friends or family members are on Medicare Advantage plans and they like that model of care, which it does seem to be gaining enrollment numbers every season, we see Medicare Advantage taking more market share from Medicare Supplement, which is why your is going to offer you that silver sneakers. They're trying to keep people over on the Medicare Supplement side. And really, for my professional opinion, there's not a right or wrong fit here. It's really what's going to cover your health conditions the best. Where are you going to be able to receive health care where you want to receive your health care? Are your prescriptions covered well? Are you going to utilize those extra benefits of the Medicare Advantage plan, or is that something you're really not going to take advantage of? And so we have to look at your financial situation, your health conditions, your prescription drugs, and try to help point you in the right direction. But at the end of the day, we just want to be here to answer any questions you've got about either pathway. Make sure you know what your actual numbers are. As a broker, we're able to shop around for you every year. Make sure you got the best rates on your Medicare supplement policy. Make sure you're in the right Part D plan, or if you choose Medicare Advantage, that you've found a plan that your doctors are in the network, your drugs are covered, and you understand the out-of-pocket exposure that you face with the Medicare Advantage plan. Any questions about that?